Hey everyone, and welcome to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Gollenvogt, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. And as always, the original article with its associated images will be linked in the show notes below. So without further ado, let's get into this week's article titled, "A Sprained Thumb, the 6-Step Guide for Patients." Whether skiing or not, it's quite common to seriously injure your thumb from a fall or a twisting injury. If severe, a skier's thumb often requires surgery and is best repaired shortly after the injury. Today's article will bring you up to speed on understanding thumb sprains so you're equipped to make decisions in the best interest of your health. While there are many names for this injury, skier's thumb, gamekeeper's thumb, this is a common injury that results from a tear of the thumb ulnar collateral ligament, or the UCL. When functioning normally, the thumb UCL gives stability to your thumb when you pinch. When torn, the thumb becomes unstable with pinch. The thumb simply gives away with any force. While the name may make it sound benign, these injuries can be serious. If the tear is complete, it typically requires surgery. Thumb UCL injuries occur with any forced abduction injury, whether from a fall, a ski pull, or a sports contact injury. Abduction is pulling the thumb away from the index finger. Adduction is the movement of the thumb towards the index finger. As an example, this is a common injury in football quarterbacks. If the hand is struck while throwing the ball, the thumb can be forced into abduction, resulting in a thumb UCL tear. So what are the symptoms of skier's thumb? These typically include pain, swelling, bruising, or a sense of instability when pinching. These symptoms are felt primarily on the inside of the thumb near the web space. Because the thumb UCL gives support to our thumb for pinch, a tear of this ligament will lead to painful instability with use of the thumb. It cannot be understated how critical this ligament is to the normal functioning of your hand. So how do I know if I have a skier's thumb? The diagnosis of a skier's thumb can be a little tricky. It certainly is one that benefits from visiting a hand specialist who can detect subtle differences in the tension of your thumb ligaments. But there are some telltale signs that make a thumb UCL injury more likely. If you are tender when you push directly on the inside of your thumb at the injured joint, it is likely you sprained or tore the UCL. Beyond that, hand specialists can gently grasp your thumb and carefully move it side to side. I typically will compare how the tension of your injured ligament feels with your uninjured side. In a completely torn UCL, as I move your thumb to the side, I will be unable to detect any firm endpoint to the tension of your ligament. Instead, the bones just keep sliding. If there is any doubt, or if we are considering non-operative treatment for a partial tear, an MRI seals the diagnosis. MRI shows us the torn ligament and how much it has retracted. In these cases where the examination is unclear, it is important to obtain an MRI quickly so the decision can be made for timely surgery if needed. The sooner the surgery is performed, the better the outcome. So what is the treatment for skier's thumb? Skier's thumb treatment is 100% predicated on the extent of your tear. Partial tears of the thumb UCL that are identified and treated immediately can be immobilized in a cast, no surgery needed. Typically, you can expect about 4 to 6 weeks in a cast, followed by a transition period with a brace. I personally restrict heavy thumb activity in such patients for 3 months after the start of casting. Even with perfect non-surgical treatment, most of these patients note a lingering soreness in the thumb for somewhere between 6 and 9 months after the injury. It's a slow recovery. If the tear is complete, the majority of hand surgeons would recommend repair of the ligament. Because this ligament is so crucial to the ability to pinch, a surgical repair is the most reliable path to healing. The success of thumb UCL repair is best when completed within about 3 weeks following the injury. Beyond that, the chances of a successful repair will decrease with time. When too much time has passed for a successful repair, somewhere between 6 and 12 weeks, the surgical option is a ligament reconstruction. This is a much more invasive procedure that utilizes a tendon taken from elsewhere in your body to act as a replacement thumb ulnar collateral ligament. A reconstruction surgery is generally successful, but not to the same level as an immediate repair. So the bottom line, don't delay in seeking care following a significant thumb injury. So what is the surgery for skier's thumb? The surgery to repair a skier's thumb involves reattaching the ulnar collateral ligament to the bony surface from which it tore. Conceptually, this is actually pretty simple. The ligament can rupture in different ways, but it most commonly pulls off the bone distally, or at the end nearer to your thumbnail, rather than nearer to your wrist. Sometimes it will even tear in the middle or pull off a small piece of bone that we term an avulsion fracture. Don't worry too much about the details. When the ligament pulls off the bone, we fix it with a small device known as a suture anchor. This anchor is a plastic or metal screw through which sutures are threaded. The screw is then placed into your bone, and the exposed suture threads are woven through your ligament. The final knot will compress the ligament down to the bone so it can heal over the ensuing 6 to 8 weeks. Depending on the severity of the surrounding damage, I will often secure the repair with a second suture anchor and a suture bridge between the two to protect the ligament from external stresses while it heals. This technique is known as the internal brace. I have no affiliation with Arthrex, the creators of this product. This also allows me to accelerate your rehab rather than needing to protect a single repair point more carefully. So what is the recovery timeline after surgery for skier's thumb? Remember that recovery is a subjective term, and for some can mean the moment of no longer needing a splint, all the way to returning to high-level sports. Below is my outline for standard healing following the surgery, specifically for when I use the internal brace technique that I mentioned above. From surgery to 2 weeks, I'll have you wearing a post-op splint full-time with no thumb use or motion. At 2 weeks, you'll have a removable splint made by hand therapy, and you'll begin to work on gentle thumb range of motion exercises. No physical use of the thumb. At 6 weeks, you can initiate light pinching activities with therapy and continue to work on range of motion. You'll start to wean out of the brace for light activities. And at 8 weeks, you'll be allowed to progress strengthening of the thumb with therapy and continue to use the brace less and less. By 3 to 4 months, you can return to heavy activities or impact sports. Most patients feel 90% of their former selves by this point. Occasional aches and pains, or a bad day here or there, are still expected. In 9 months to a year, you'll achieve quote-unquote full recovery, where you may have to stop and think about just which thumb you had injured. So wrapping it up, while there's far more to know about the ins and outs of thumb UCL injuries and their treatment, this article should give you the essentials of understanding this condition. Thanks for being here. See you next time.